Hello, 8th graders. I'm Dr. Emerick Palmer. I have been asked to assist with your 8th grade circulatory system project. You have just heard a wonderful presentation about the circulatory system. It's essentially a part of it, that is the lymphatic system. The circulatory system that everyone is familiar with includes the heart, the arteries, and the veins. The heart pumps blood through the arteries to the tissues. At the tissue level, blood or fluid comes out of the capillaries into the tissue, and when in the tissue, after the fluid has done its job, given off oxygen, etc., it comes back into the veins and comes right back up to the heart. Now, not all the fluid goes back into the veins. Some of it returns to the heart or the other part of the circulatory system through the lymphatic system. Now, the presentation earlier discussed the normal structure and function of a healthy lymphatic system. I have been asked, however, to briefly discuss the issues or problems that arise when there's a diseased or unhealthy or malfunctioning or dysfunctioning lymphatic system. As we know, the lymphatic system is a system of tubes that drain fluid back to the heart, as mentioned. If there's a blockage in the tubes, then that leads to congestion or accumulation of fluid in the part that is supposed to be drained. For example, a leg or any one of the legs drains through the main lymph node in the groin, which is called, those are called the inguinal lymph nodes. They drain through the inguinal lymph nodes into other parts of the lymphatic system. If there's blockage at the inguinal nodes, that is at the groin, at the top of the thigh, the inside of the thigh, then fluid accumulates in that leg and the leg begins to become swollen. Different things that can cause blockage include, one, a worm that is called the filaria worm that causes blockage. The worms go into the tubes, block the tubes, and then there's the fluid buildup. That can be so massive that such legs have been termed, or that condition has been termed, elephantiasis. Other causes of blockage include trauma. If somebody has a broken thigh that traumatizes or disrupts the lymphatic system at the thigh, then that can also lead to a blockage of the lymphatic drainage from the leg and swelling of that leg. The second dysfunction that I will discuss is one in which the lymph nodes, which are supposed to participate in dealing with infections in the body, when they become infected themselves. That can happen with things like tuberculosis, which can lead to infection of a lymph node and cause what is called tuberculous lymphadenitis. Sometimes that happens in people's necks and causes really large swellings, etc. Now, another dysfunction of the lymphatic system is when there is a malignancy. Now, a malignancy is when any tissue multiplies or proliferates abnormally and excessively. And that is called a tumor, and sometimes these tumors can be fatal. In other words, they can lead to the death of the patient. Now, when that happens in the lymphatic system, it is called a lymphoma. Now, these are just three of the different types of dysfunctions that can happen in the lymphatic system. One, blockage of the tubes. Two, infection of the lymph nodes, which is supposed to participate in helping the body fight infection. And then thirdly, abnormal growth or multiplication of the lymphatic system, which is a tumor, and that is a malignancy called a lymphoma. Thank you. Unfortunately, I can't answer any questions. This is not being done live, and I must also apologize for the my scheduling conflict that would not permit me to be with you this morning in your class. I hope you have a great time, and I wish you all the best in all your projects. Thank you.